This presentation is going to cover the basics of fall prevention. By the end of this presentation, you should be able to recognize and remove environmental hazards that may cause a fall, recognize the need for a PT evaluation to evaluate balance, gait, or the need for an assisted device, and recognize and adjust improperly fitted assisted devices. Tip number 1 is to survey the environment. Tripping or slipping on objects that are left on the floor presents a huge fall risk for patients, especially if they have difficulty with walking and balance already. Before getting a patient up and moving, it's important to make sure the walking path is clear of any obstacles or miscellaneous objects that the patient may trip on. As you can see in this video, there are many things that have been left scattered along the floor and could be a potential hazard for this patient. When this patient gets up to walk, it's easy for him to slip on one of the objects and fall, possibly hurting himself. This easily could have been avoided if the object was removed prior to the patient standing up. Watch as this caregiver walks through the room, making sure to pick up any objects on the floor that were left behind. Watch out for wires, as they're hard to see but could be very dangerous for a patient. Tip number 2 is to keep personal items at a safe distance. When a caregiver is not present, patients must be able to reach their belongings on their own. If what they're trying to reach is too far, they may lose their balance trying to grab it and fall. Often, patients don't realize that they can't safely reach the object until it's too late. By keeping the patient's personal belongings at a safe distance, we can reduce the chance of them hurting themselves when we are not there to help. Tip 3 is to clean up spills immediately after they happen. Although spills are common in an assisted living facility, it's important to clean them up as soon as they happen, as wet floors can pose a huge hazard to patients who are walking around. If you're not able to clean up the spill right away, make sure to leave a caution sign in that area to warn people who are walking by. Tip number 5 is to make sure the walking areas are well lit. In dimly lit areas, it's a good idea to plug in a nightlight near the floor to illuminate the walkway. This will help patients visualize where they're walking better and will help them prepare for uneven surfaces or any other obstacles in their path. Tip number 5 is to check handrail durability. When going up and down stairs, many patients rely on handrails for balance and support. If a patient puts weight on a handrail and it is not properly secured, they may lose their balance and fall. To make sure the handrails are sturdy, give them a little tug in each direction. They should not wiggle or come loose. Tip number 6 is to make sure assistive devices are fitted properly. Adjusting walkers and canes to fit the patient's height can play a huge role in how well they're able to balance and walk. Take a look at these pictures. Out of the 4, which 2 do you think demonstrate the correct height for this patient's cane? If you picked C and D, you are correct. When fitting a cane, our goal is to have the top of the cane meet up with the patient's greater trochanter of their femur, or the crease of their wrist when they let their arm hang by their side. Additionally, we want to make sure that the patient's elbow is not bent too much, as it is in pictures A and B. In these pictures, you can see how to properly fit a walker. Notice that just like with the cane, his arms are slightly bent and the walker reaches his greater trochanter or the crease of his wrist if his arms were to hang down. The final step is to practice safe patient handling. When getting a patient up and moving, it's crucial to make sure that they're not going to be at a risk for falling. Here are some simple steps to make sure you're taking the correct precautions when ambulating a patient. First, ask the patient to scoot forward in their chair. Then, secure a gait belt around their stomach, near the umbilicus. The belt should be snug, but not too tight. For reference, you should be able to fit your first 2 fingers in between the belt and the patient, but not much more than that. After this, have the patient lean forward and help them stand up. While the patient is walking around, you should always be ready in case they lose their balance. The hand in front of them should be guarding the front of their right shoulder, while the hand in back hooks under their gait belt. This hand positioning allows for the most control and will help you save a patient if they lose their balance. This concludes the presentation. By following the 7 steps discussed in this video and listed on this slide, you can ensure that you are keeping your patient safe and minimizing their risk of falling. Thank you.